Hi, today I want to talk to you about facial fillers. Now, there are several materials that can be injected into the face in different areas, but probably the most commonly used today would be a hyaluronic acid based filler. The fillers that I prefer would be Juvederm, Voluma, and Valbella. These are all made by the same company, Allergan. And they're used in different parts of the face. The Voluma, which would be the one that volumizes the most, is mostly used to improve or give a person a larger cheekbone. It needs to be injected deeply on the bone, pushing the soft tissues forward so that there's enough soft tissue coverage to minimize any lumpiness or irregularities. Juvederm is probably the most versatile, and that can be used pretty much anywhere in the face, but most commonly it would be used in the nasolabial folds, in the marionette lines, or in the nasal or the depression right before a person's jowl or in front of a person's jowl. And it also is very commonly used in a person's lips. The newest filler, Valbella, is very thin, and it's the first filler, or one of the first, that can actually be injected into the deeper portions of the skin. So it's very good for the fine wrinkles around the person's mouth. When a person has significant wrinkles, such as a smoker, those are best treated by some form of skin resurfacing. However, all of the skin resurfacing procedures change the pigment in the area a little bit. So when a person is having a facelift, let's say, and maybe just has a few fine wrinkles, then this new filler, Valbella, would be ideal for that. And the beauty of the Juvederm or the hyaluronic acid fillers is that they're reversible. So anybody injecting any of these fillers should know, number one, how to do it to minimize complications, where they can be injected. But most importantly, they need to know that they can reverse it. And I've talked to several patients who have been told about Juvederm by one person or another, and then when I mentioned to them, well, you can reverse these, they're a little bit surprised. So there is a liquid that can be injected in the area where the filler has been injected to dissolve it if the patient, for instance, doesn't like the way it looks. That's best done shortly after the procedure. And the other thing about the hyaluronic acid fillers is that they're not permanent. The Voluma will last probably around 2 years, Juvederm around a year, and the Volbella similarly probably around a year. There are some permanent fillers. However, permanent fillers are really not a good thing to inject into the face. They're not new. The original permanent filler was silicone. It was very versatile, very inert, and it was injected all over patients' faces. But what happens is a face changes as you age. The fat thins and atrophies, the skin thins and weakens. And if the filler stays in the same place and doesn't change, it can look somewhat strange, possibly over time, and it also causes the body to create a very mild inflammatory reaction, which is one of the reasons why these dissolve over time. And if this is going on for a long period of time, trying to dissolve a somewhat non-dissolvable substance, you can have granulomas and things that can form, but that's not common. But the bottom line is most plastic surgeons today who do fillers will choose to inject a filler that's not permanent, and I think that the hyaluronic acid fillers are probably the filler of choice nowadays because they're very versatile and they are reversible. Thank you.